Hello there, Dr. Dennis Fiorini here with Fiorini Chiropractic Center. Today we're talking about an injury called whiplash. Very often people think that whiplash is a very simple type of an injury both to occur and to recover from. One of the big problems is first of all, a rear end collision is the most common type of collision that causes a whiplash. But one of the things that you need to take into consideration when considering if you have an injury like this is, number one, you can't just get out of the car and look at the back of the car and see if there's any damage done to the car. And if there isn't, say, well, there's no way that I could be injured because there's nothing wrong with the car. You have to take into consideration that this is a big metal piece of equipment and it weighs probably about 3,000 pounds at least, and it is made to absorb large shocks. When we're dealing with small impacts or low impacts like usually occur if you're stopped in traffic and somebody isn't able to stop, perhaps they might hit you at 5 or even 10 miles per hour, you might think that that's not a very big impact. And it truly isn't when you look at a car. But when you deal with what's going on inside of the body in these types of conditions and these types of traumas, you have to take into consideration the person that's inside the car. So think about what happens when you're sitting in that car and you're just at a complete stop. You're not moving. The other vehicle hits your vehicle, and what essentially happens is you get suspended in midair for just a second. What happens is you actually come up out of your seat a little bit, the car moves up underneath you, and then it comes in contact, or your body comes in contact with the seat back. As that occurs, that throws this part of your body forward, and your head kind of stays and lags in the motion. So what happens is, I'll turn to the side, what happens is your shoulders go forward and your head kind of stays where it is. And as that car comes forward and the seat belt grabs you, your body goes forward and your neck goes back like this. The actual injury takes place about at this position here. So what you actually get is an S-shaped curvature. When you look at the cervical spine or the neck from the side, you get this S-shaped curvature, which puts a lot of stress in the middle to lower part of the neck, as well as at the upper part of the neck. So what happens is that comes forward, the head stays kind of still for a second, and then it catches up, so it goes back and then forward, and that's where you get the whiplash type of the injury. What happens very often with no damage done to the car is you get tearing of some ligaments in the neck. There's some that are called the anterior or the front longitudinal long ligament in the front part of the spine, the posterior longitudinal ligament. You get damage to what's called the facet capsular ligaments. You can get damage done to the nuchal ligament, to the interspinous ligament, and to the supraspinous ligaments. So, as well as some others, and damage to the disc as well, because the disc is actually connected to the anterior and posterior longitudinal ligaments. So you can get a lot of damage done in there with little or no damage done to the car. The only way to really see if there's any damage in there is to get an examination with a spinal specialist, like a chiropractor, like we do at our office. You may need to have x-rays, especially what's called flexion, extension x-rays, or bending forward, bending back x-rays. Perhaps what's called a dynamic motion x-ray, which allows us to see the spine in motion under an x-ray. It's a motion picture x-ray is what it is. So it's very, very important to do these types of diagnostics, possibly even an MRI with you bending forward and bending back. Very important to do these types of diagnostics to find out exactly what's going on with your spine. If we don't do these diagnostics and figure out what's going on and what could possibly be going on with our spine, what tissues are actually damaged, a doctor, either a doctor of chiropractic, a physical therapist, or a medical doctor, they could hurt you with their treatment unless they know exactly what's going on in there. So that's one of the things that I wanted to talk about today, about whiplash and how it is a very complicated type of an injury, you need some very extensive, sometimes diagnostic imaging so that we can see exactly what's going on. And certainly after a motor vehicle crash, you need to be examined by especially a spinal specialist. Certainly it could be an orthopedist, but certainly we would recommend coming in to see us, a chiropractic physician that kind of knows what's going on with the spine. That's where our practice is centered on, is on the spine. In our office in Fiorini Chiropractic Center, we really focus on the cervical spine or the neck. So if there's an injury in there, it could cause neck pain, it could cause headaches, it could cause problems coming down into the neck, down into the shoulder, down into the arm, perhaps into one or two of the fingers in your hand. So if you have any of these types of conditions, any of these types of symptoms, if you've been involved in a motor vehicle crash, we'd be happy to try and help you. Hopefully that this information has given you a little bit more understanding of what can go on. If you like it, please go to my YouTube video channel. You can subscribe to video alerts on there, or you can go to fiorinichiropractic.com, where you can get a little bit more information about our practice, as well as more information about the different types of conditions that can affect your spine. Thanks very much. I'm Dr. Dennis Fiorini with Fiorini Chiropractic Center. Have a happy and a healthy day.